So you want to know, can healthcare information be trusted? Well, in this video, you're going to learn all about healthcare information and whether or not it can be trusted. Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, a urological surgeon and former researcher. And this channel is all about routine medical conditions, self-care, and digital health, so you can be informed and in total control of your medical needs. If this is your first time on the channel and you like to get fact-based healthcare information, please hit the subscribe button for me. By the way, HEALTHdrum is for educational and informational purposes only and not a substitute for professional medical advice. The links to the material and the disclaimer are in the description below. So let's get into it and start sorting fact from fiction. So why is it that some 30 to 40% of all healthcare consumers don't trust healthcare information? There are a number of reasons why healthcare information cannot be trusted. Healthcare is mainly financially driven, most published medical research is false, and only about 11% of all medical treatments are of known benefit. Many medical guidelines are inconsistent and often vary between physicians and their government oversight agencies. And there's been substantial politicization of health. Healthcare information should be based only on irrefutable and reproducible data. So let's look at the issue of healthcare being mostly financially driven. Why is that? So big industry heavily sponsors physician clinical trials, publications, and meetings. Big tech can influence study design, so results are biased in the favor of the company's narrative, and they can downplay negative results very easily. As well, they influence where and how this information is published. They also pay for meetings and conferences and offer consulting fees for so-called keynote speakers. All of these profit motives, sponsorship, and conflicts of interest impacting big pharma, big tech, and medical device firms absolutely erodes the credibility, objectivity, and completeness of healthcare information. So how does money or financial orientation influence healthcare information? So profit incentives shape research in many ways. As well, patient data becomes a commodity. Access to healthcare information is unequal, and there's the influence of direct-to-consumer marketing, especially on TV. All of this leads to prioritizing profit over disease outcomes. And money influences healthcare information for several purposes, especially investor returns. They focus on high-revenue procedures, costly drugs, repetitive billing, profitable treatments, and repetitive treatments for chronic diseases. So why is most published medical research false? So most published medical research is false because invariably the studies are not based on sound scientific principles, meaning the study design doesn't compare apples to apples. Also, there's intentional or unintentional research bias, and the study is often impacted by opinions, assumptions, and beliefs. Also, many studies have inadequate sample sizes, and statistics are commonly massaged or manipulated. Also, there's commonly inadequate study time length, especially when years of follow-up are required, and importantly, most of the studies cannot be replicated to prove the results of the initial report. That is, for most studies, there's a lack of irrefutable and reproducible data. Let's now turn to why only about 11% of all medical treatments are of known benefit. Why is that? There are a number of reasons why most medical treatments are of unknown benefit, despite being called standard of care. For the most part, almost all medical research is not founded on sound scientific principles, and there's a reliance on outdated practices, beliefs, opinions, and assumptions, as well as the influence of egos. Commonly, there's a lack of randomized control studies. Most studies are only of short duration, and many studies are incentivized financially. Again, the references to the material in this video are in the description below. So what about the revolving door that's known to exist between the U.S. healthcare regulatory agencies and the private sector? Clearly, there's a very cozy revolving door relationship between the U.S. healthcare regulatory agencies and the private industry. 57% of personnel exited the FDA to go to private industry. 32% exited from the CDC and CMS to go to private industry, and 15% of those in the CDC and CMS came from private industry. This relationship opens the door to financial conflicts of interest, which can result in guidelines favoring the private sector. Clearly, these conflicts can erode public confidence in the regulatory agencies and in the tests and treatments they recommend. So are there any other groups in the healthcare arena that are influenced by money? So various healthcare foundations and support groups receive significant corporate funding. For example, those making the equipment to measure the PSA blood test for prostate cancer fund various organizations to promote PSA-based screening and prostate cancer awareness. Yet, studies have already shown that PSA testing fails to save significant numbers of lives and that the harms of PSA-based screening outweigh any benefits. These companies profit from the recycling of misinformation. In fact, much of the material about prostate cancer and prostate cancer awareness is only recycled misinformation. What about other medical groups such as medical societies and physician associations? Are they influenced by money? So corporate funding also influences medical groups, societies, and physician associations. There are financial incentives in the way of speaker fees, paying for food and drinks, and there's market-driven education, so corporations drive the topics for meetings that are important for selling their products. They supply coupons for new drugs, trying to get physicians to prescribe them, and they sponsor physician publications as well as their meetings. So let's look at medical guidelines. Can they be influenced by money? So many of the authors of medical guidelines have financial ties with the medical industry, and industry-funded research induces biases and skews evidence, as well as delivering self-serving disease definitions and lowering the thresholds for testing and treatment. The clout of these organizations allows them to lobby lawmakers and put pressure on medical societies and their medical guidelines, which then influences insurance coverage. To underscore this issue, in 2019, $600 million was spent by the healthcare industry lobbying government lawmakers. So what are some of the other reasons that healthcare information cannot be trusted? So this screenshot lists some of the factors causing mistrust in healthcare information. Social media platforms where much of the content is written by lay people. Then there are the influencers and celebrities recycling misinformation and half-truths. As well, low-quality news outlets sensationalize misleading information simply to get views. Also, for-profit companies can spin so-called health benefits, and alternative medicine websites often market so-called natural cures along with fanciful claims about boosting this, that, and everything else. Sadly, both traditional and alternative healthcare information is impacted by misinformation, and both sectors heavily recycle this misinformation. So what sources can be trusted for reliable healthcare information? So there are a number of trusted sources for healthcare information. Just remember the word trusted is relative. Government health agencies such as the CDC, peer-reviewed journals such as the New England Journal of Medicine, academic medical centers, licensed healthcare professionals, and online sites such as Medline Plus and Health Finder. They can be generally trustworthy, but again, nothing is 100%. So what can you do to check on the trustworthiness of healthcare information? There are a number of things to look for when trying to check if the information you're reviewing is trustworthy. Is the author or authors, are they qualified in that particular subject? Is it published in a credible journal? Does the article cite references? Is the article peer-reviewed and by a credible institution? And is the study or article supported by scientific evidence? However, none of these checks are a guarantee that the information is 100% trustworthy. And another reason why you may want to check on the trustworthiness of medical recommendations is that medical care costs you money. So medical care costs you money in the way of taxes, federal and state, health plan premiums, health plan deductibles, copays, and non-covered services. And since 80 to 90% of all the health care delivered is generally affordable, routine, office-based, and outpatient care, you are likely to pay for some of this. And if you have to make payments towards your medical care, you should at least try to ensure that the testing and treatment advice that you are getting is trustworthy. Remember, because it's been determined that only about 11% of all medical treatments are of known benefit, a lot of medical treatment and healthcare is based on the results of very dodgy studies. So let's recap. In this video, can healthcare information be trusted? You learned that most healthcare is financially driven, most published medical research is false, and that only about 11% of all medical treatments are of known benefit. To learn more about routine medical conditions, self-care, and digital health, check out these other videos.